I am Dr.Prabha Ramadorai. I work as consultant physician and diabetologist at Nano Hospital, Hulimavu branch. As we see, the prevalence of anemia is so high, the most important thing is prevention of anemia, because it involves a lot of money involvement for the treatment of anemia, and it's easily be prevented. The most common cause is nutritional cause of anemia. So adequate iron intake, adequate iron supplements when the intake is not adequate. That's the most important thing of treatment. Iron deficiency is the most common cause of anemia. So increasing the green vegetable leafy intake, consumption of legumes and all cereals in the fermented form contributes to quite a bit of iron and vitamin B12, the most common cause of anemia. And avoiding outside as much of fast food as possible and including nutritional diet in your daily diet, especially in the adolescent age group, is a very important source of treating anemia and prevention of anemia. And we also have some hereditary cause of anemia. It is essential to identify the hereditary cause of anemia because the person themselves may not be affected. When they marry another person with a similar defect, the child will forever be dependent on blood transfusion. It's necessary to screen for hereditary cause of anemia also.